best music, 98.5 The Fox, and you're listening to Gabbing with the Gales, and it is time for Health Sakes.
For Health Sakes.
Health Sakes, brought to you by Tri-County Health, and we have Casey in here with us from Tri-County Health. Hi, Casey.
Good morning.
Thanks for joining us this morning, Casey. What are we talking about today?
We're talking nursing programs, right?
That Tri-County Health provides, right?
Correct, yeah. So I'm the nursing director at the health department, and I'm just here to talk about a few programs that we offer in the nursing services, which include things like WIC, immunizations. We have some case management programs. So things that really deal a lot with interacting with the public on a pretty frequent basis.
Right. So let's start with WIC then, because it's a word that I've heard my whole life. I've never been lucky enough to never have to use. Who benefits from WIC? What is it?
So WIC is a supplemental food program. It stands for Women, Infants, and Children, but really it can be for anybody. So dads can bring in their kids if they're under 5, grandparents, foster parents. So really it's for anybody who has children younger than 5 in the home that need a little bit of supplemental nutrition.
Okay. So it's mainly for groceries and food, is that correct?
Correct, yes.
Okay. And then you also deal with immunizations, which is kind of a big deal this time of year.
It really is. It's respiratory season, even though we're in a brand new year. We're still in respiratory season. So flu, RSV, COVID, those are types of things that we can give vaccinations for to help prevent serious illness.
And if someone wanted to take advantage of it, is it based off of level of income? Who should be looking at this?
So anybody can come in. We do accept private insurance, but then we also do the Vaccines for Children program, which is a program that gives free or reduced vaccines to families in need.
Okay.
So it goes based off of income.
Okay, perfect.
Okay. And you also have case management. I wrote that down. I don't know what it means. I know it has to do with kids. What is case management?
So we have a couple different programs where we have a nurse case manager that can help make sure that families are getting resources for their children or themselves. We have a really big program called the Children with Special Health Care Needs. And so what it does is we have a nurse who is able to really help, whether it's testing, help families get on disability support, anything that child might need, which also includes wraparound services for the family.
Oh, that's amazing. That's a lot.
There's a ton of stuff that you guys do. Is most of this supported from federal funding?
It's a little bit of both. So we get federal funds and we do get some state funds also.
Okay. Mm-hmm. And then there was one other thing you said I didn't write down, but it sounded like bee's knees. But I don't think that's actually what you said.
They don't have a bee's knees program, but they do have.
We do have a B-Wise program, which is
that's right.
Which is a health coaching program to help women, whether it's with heart health or, if they're struggling with some prediabetes or some diabetes. So we help in that way to help get them some health coaching sessions with me, actually, to kind of deal with some of those problems.
Okay. There's a ton of stuff
lot of resources you guys have.
There really are.
What would you say this time of year, it's when people are making resolutions, people thinking about, what the next year is going to look like. What do you think would be the most important thing that a family could focus on? That Tri-County Health could help with?
Oh man, there's a lot of things. There are so many things we could do. I think this time of year, especially if people are making resolutions, just being healthier is a really good thing, which is a very broad term.
Right.
I understand.
Oh, yeah, for sure.
Right.
But, always eating healthy and getting exercise and then doing the things we think of holistic. So for our mental health, interactions with families and interactions with loved ones and getting out and doing some of those really fun activities is also a really big thing.
That's wonderful advice.
That is good advice.
Fantastic
Okay,
advice.
Casey, so if somebody wanted to come take advantage of these programs or had questions for them, what's the best way to get a hold of you?
They can either call us at 247-1177 or go to our website, tricountyhealthut.gov.
And you have locations more than just in Vernal, right?
Correct. We have a clinic in Vernal and one in Roosevelt.
Okay, wonderful. So anywhere in the basin, you can head a direction, you'll make it there.
And go down to Tri-County and talk to Casey because they've got a lot of programs for you.
We do.
Okay, thanks
Wonderful.
for coming in.
Thank you so much, Casey.
Thank you.